The question posed is, why do freehand surgeries go quicker than guided surgeries? Freehand surgeries, you can go to surgery in an hour if you want to. You don't have to make a guide. You don't have to go through the process of design and planning, etc. However, maybe the right question is, what are the benefits to going guided over freehand? Because with guided, clearly you're going to control the position of the implant, the depth, the rotation. You're going to set it up for a crown at the right depth. Let's just say, right off the bat, that's an ideal way to plan a case, right? Screw access and where your margin is going to be because you've already worked up the abutment, on simple cases. But on complex cases like a GuidedSMILE, or any kind of full arch case, there are so many benefits to doing guided. One of them is just measuring prosthetic space. Instead of just using a perio probe and measuring, 15 millimeters from this to that, and then just kind of, reducing the bone to where you think it should be. It works, certainly works, it's been going on for years, but if you can plan the prosthetic thickness, you can plan the cantilever, the AP spread, the exact position of the implants, where they are in relation to anatomical landmarks. If you're on a patient with limited bone, can you put it as close as you can to the sinus? Can you plan for sinus bumps in the software? Dealing with the prolongation for where the position of the implant's going to be. Planning for screw access, for multi-unit abutment angle, for indexing and rotating implants so that you have the best position of the exit point of the screw in the anterior and posterior. There's a lot to think about. That's all covered when you're planning planning a guided surgery case. Every time we plan a case, it's from tooth down, or tooth up, depending on which arch you're in. Everything is about the final restoration, as opposed to just the implant position or maybe the rotation of the implant or placement. It's all about the tooth position, and that's what patients want. They want beautiful teeth that are easy to work with. It's certainly a lot easier to level the bone when you're guided. It's easier to plan for a nice level position as opposed to implants at different heights because it's all pre-planned. So there are many, many advantages to using guided surgery over freehand. Yes, the surgery might take longer, but the benefit is that I would make the argument that the surgery is better being planned, and I also make the argument that the whole restorative protocol on a guided case is better than freehand. So is one really faster than the other? I think you got to look at the whole picture.